Hello! In this video, you'll move away from the idea that you're just plain stupid and toward the sense that your brain does have certain strengths and weaknesses at every age. We'll explore the process of a neuropsychological evaluation, what it is, what the process is like, and how you can use it to ease anxieties and pave the way for healthier brain functioning. It includes a quick quiz on brain blips that maybe we all experience, and I'll give some ideas on how to prepare for a neuropsychological evaluation. You might have had a conversation with your primary care provider or a neurologist, and they told you that a neuropsychological evaluation would be useful. Or maybe you're just one of those super prepared people who is aging and wants to know how their brain is doing before they have problems. Or maybe you've experienced a lot of worry about how your brain is working, and it's gotten to the point where you don't want to worry anymore and you want to take steps to find out what's actually going on. I see so many people in this boat. They're worried about how their brain is working, and they're suffering both emotionally and cognitively. Yes, worrying about your brain can actually make your brain work worse. Who doesn't worry about what they've done in some ridiculous way in terms of brain functioning? Here's a quick quiz that you can see and rate yourself on how many blips or blunders you've experienced in the past week. Give yourself a point for each one you think you've done, or if you don't remember doing it, each one that somebody has told you has been a problem. 1. I've gone into a room and forgotten why I'm there. 2. I've been talking to someone and can't easily produce a specific word. 3. I've put my keys someplace that I cannot easily find them. 4. I've misplaced my cell phone more than once in any given day. 5. I've seen someone that I know in public, maybe at the grocery store or some other venue, and I can't quickly remember their name. 6. I've planned to do a specific task, but the whole day went by, and at the end of the day or the next day, I've realized I've completely forgotten to do it. 7. I either went to an appointment or told somebody about an appointment or some social engagement, and it was the wrong day or wrong time. So now, what's your score? You can even pause the video, add up all the things that happened to you in the last week or so, and put it in the comments below. Funny enough, these experiences are more common than you think. Depending on the week I examine, the quality or amount of sleep I've gotten, the craziness of family demands, or my work schedule, my personal score has ranged from a 3 to a 6 out of 7. This is not uncommon for people. The bottom line, we all experience blips in our cognitive functioning. Despite the truth of this idea, many people don't feel better by hearing me say this. I bet you don't feel better by hearing me say this. Why not? Because it's just so hard to know. Are you aging normally or not? 1, you've never been this age before, so you don't know what it's supposed to be like to be aging normally. 2, you ask your friends or family and they minimize the problem. Oh gosh, that happens to me too, ha ha ha, no big deal. Or you go to your primary care doctor, and if you've raised the courage to talk to them about this, there may not even be time in that limited window that you have with your provider to be able to tell them about your concerns. If and when you do tell them about your concerns, some providers may not have the training or experience to recognize your level of worry about the situation and take appropriate next steps with you. They may minimize the situation, saying that you looked fine in the few minutes that they talked to you that day. This is where a neuropsychological evaluation can come in. It can give you the data to help you stop worrying and have a plan of action to have a healthier brain. So what is a neuropsychological evaluation? Neuropsychological evaluation is testing to help understand how a brain is functioning. As an example, if a picture of a car or a car's engine can help us understand the structure of that particular thing and help us understand how it's functioning because of structural changes, that would be the equivalent of brain imaging. Driving a car and getting a feel for how it handles and how it functions. It might be how well it steers, how quickly it accelerates, or the functioning of the brakes. This is the equivalent of neuropsych testing. It's giving you data on the functioning in a particular situation. Neuropsych testing is standardized, meaning that the tests are given in the same manner to all patients and are scored similarly each time. And individual scores are interpreted by comparing those scores to people kind of like them in terms of things like your age, your education level, and so on. People who are kind of like you, who are supposed to be aging normally. What does a neuropsychological evaluation involve? The first part of a thorough neuropsychological evaluation is generally an interview, where the doctor will ask you about various things. One component is your history, what experiences you've had, how you've lived your life, how you functions, things that make you you over time. They'll also ask about your experience with current brain functioning. Things like, how well is your memory working? Are you having any problems with language? Or is there an issue with problem solving? This will often lead to a discussion about problems you're having in everyday life and what your concerns are about those issues. The interview can last sometimes around an hour or so, but this can vary depending on the complexity of your situation and what information the provider has already been given about you. The second part of a neuropsychological evaluation is the actual testing. This is often the form of paper and pencil tests, but some things are administered on computer as well. Most of the tests have to be administered by a psychologist trained in this type of testing, a neuropsychologist. But sometimes you'll work with a person who is not the psychologist, but who has been given specific training in administering these types of tests. This person can be called a psychometrist. This type of testing can be a longer process. If you've ever been to your primary care doctor and they've done a cognitive screen, I think about that kind of testing experience like a taste test at your local grocery store or at Costco. Pretty quick and easy. With this type of testing, it's a lengthier experience. I compare it more to a 7-course meal, where your provider will spend time to go through various areas of brain functioning in very much detail in different ways. Testing time can vary from a couple hours to an entire day and could be completed in one session or more than one session, depending on your situation, the complexity of the testing, and your energy level. It is always okay to raise concerns about fatigue during a testing session. I always say we want to collect good data. And so if someone is so tired that they can't focus, they can't attend due to this idea of just being fatigued, at the end of the day, I don't want to say, well, we know that your brain doesn't work as well when you're tired, because that doesn't tell us anything. Everybody falls into that category. If you're feeling too tired to continue, or if beforehand you're worried that one testing session might be too long for you or for your loved one, please feel free to bring up these concerns. In most cases, you can work with your provider to make the experience comfortable so that fatigue doesn't play into or impact the results. That being said, it's also important to recognize that the session doesn't have to be a marathon, that it can be broken up by taking breaks, having snacks or a lunch, but in a way that actually feels comfortable for you and your body. The last component, and arguably the most important part of the evaluation, is the feedback session. This is where you come back at a later date to discuss the results with your provider. They will have taken many hours to score the data and then norm it, which means, again, they will statistically compare you to people kind of like you, your same age, education level, and so on, to understand how do you compare to them. Where are your cognitive strengths and where are your cognitive weaknesses? They will also have reviewed medical records that are available to them, all of the information from the interview portion of the assessment, and have put it all into a comprehensive report. So this leads to the question, why have a neuropsychological evaluation, or how is it useful? This map of brain functions can give us indirect information about the structure and function or integrity of the brain. What is happening to your brain and what might be causing it? This data can help to clarify diagnosis and lead to a more informed treatment plan. Data from neuropsych testing can help with the before and after of neurosurgical procedures, things like deep brain stimulation, to understand, are you a good candidate for these types of procedures and have you benefited from them? Neuropsych testing can help reveal brain strengths and weaknesses. This is crucial because understanding basic brain functioning can help us lead to an understanding of what's happening in your daily life. Things like, do you have a memory problem and how is that impacting your functioning? Or do you have a frontal lobe or executive problem that's actually impacting different aspects of your experience and will lead to different interventions? This can matter for daily life activities like managing your finances, taking medications accurately, driving, living independently, and engaging in all of the activities that you want to do on a regular basis. This can also help us understand whether various forms of therapy or rehabilitation can be useful to you in your treatment plan. For example, this might direct interventions that could include cognitive behavioral therapies, occupational therapies, or speech therapies. This can also help us understand if there are other ways to work around or cope with a problem. How can you use your strengths to maximize quality of life and continue to flourish? Finally, neuropsych testing provides a wonderful baseline for future comparisons. Whether you go back to the original provider who tested you the first time or you go see another provider, the data will be there so that they can compare and assess change over time. This is very useful in tracking cognitive functions over time, understanding diagnoses, and helping to promote quality of life. So how do you prepare for a neuropsychological evaluation? First, you don't study for it. Don't worry about boning up on your algebra or your spelling or world history. This is supposed to measure how your brain is functioning right now. Second, try to get a good night of sleep before the evaluation so you can feel rested and at your best. Tell your examiner beforehand if you tend to function better in the mornings or the afternoons so you can schedule the evaluation in a way where you feel alert and energized. Bring any assistive devices you might have, including glasses or hearing aids. Also ask to see whether or not there might be a break during testing where you could have a snack and bring food so you can be prepared. Bring water or ask for water while you're at the evaluation. Remaining hydrated can contribute to healthy brain functioning. Bring a list of your current medications so that your provider knows what you're taking in case any of those might be impacting brain functioning. Try not to worry if you're going to pass the tests. With neuropsych testing, the tests are constructed in a way so that no one can get them all right. If people got them all right, they would have to go change the tests and make them harder so they couldn't. Some of the tests start out very easy and get very difficult. They're supposed to. All you have to do is try. As long as you're trying your best, that is the whole point of the evaluation, to capture the strengths and weaknesses of your particular brain function. This can be challenging for some people because as soon as they feel like they're not getting something right, they immediately catastrophize. Oh, I'm failing, my brain is mush. And when that happens, they can't focus as well on the testing. Your provider won't be able to tell you how you're doing that day because they won't have all of the data. But this is what the feedback session is for. And when you come back, they will tell you everything about how your brain is working. Finally, at the end, don't be worried if you do feel a little tired. This is completely normal. People aren't used to using their brain for an extended period of time. So at the end, expect to feel a little tired and go do something nice for yourself and take it easy. This video has helped you understand the concept of a neuropsychological evaluation, what it is, what it's good for, and how to prepare for it. It didn't tell you the various domains of brain functioning that neuropsych testing can help to evaluate. So if you want to learn the specifics of that information, here's a video for that. Thank you so much for sharing this time with me. The part in me that tends to worry about things in life bows to the part in you that might do the same. Here's to sharing our worries together and doing something about them.